The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
I felt pretty safe. I felt like this is the best place to be, you know, as far as being exposed or whatever. They're taking all the precautions.
Brent Akasada had a kidney transplant about 3 months ago at Intermountain Medical Center.
We got there and they wouldn't let any visitors in, and they made all these, you know, precautions, make to sanitize your hands, put a mask on, wouldn't let any visitors in. You know, that kind of eased my mind a lot.
Although many non-essential surgeries and procedures were recently delayed, organ transplants are considered essential and should not be postponed if possible.
If I put you on my list, the last thing you want me to do is say, oh, sorry, kind of preoccupied with coronavirus. That would be terrible. So that's not going to happen.
Before a transplant, doctors weigh the risk of doing the surgery, postponing it, and the risk of potentially being exposed to the virus.
You don't want to do a transplant on someone who's infected, because we know that if you transplant an infected person, you put them under an anesthetic, the potential for their lungs developing a more severe injury is considerable. So what we do is we do things to make sure that they're not infected, and then afterwards we prevent infections.
For Brent, having this transplant during the pandemic changed his life.
I can do things without having to plan my life around the dialysis, and I can eat things that I used to not be able to eat. I can drink more water than I was on dialysis. When I was on dialysis,